about to listen to the Dr. Daliah Show. Sassy, stimulating medical talk radio. Any medical advice Dr. Daliah Wax gives on her show should not be substituted for an actual visit to your medical provider. And now, here's Dr. Daliah.
All right, we are back on the Dr. Daliah Show. Thank you all for tuning in. 1-877-Dr. 1-877-DOCDALI. So protecting our children should be first and foremost. And I think the conversations went completely made a complete left turn as it pertained to gender dysphoria and what the safest thing to do for a child is. And while one side says what we need to do is if a child, and we're talking a child who doesn't understand the ramifications of breastfeeding and fertility and heightened risk factors of medications, etc. If a child thinks they're gender dysphoric, one side says never let them get to puberty, because then it's going to be infinitely more difficult to try to turn them into another biological sex, which is impossible. You're not actually making them another biological sex. Okay, we can't be lying to these kids. The other side is saying, why are we hurting our kids, especially when they can't give informed consent? Well, in Europe, especially the UK, they're like, no. I mean, if someone's already enrolled in a clinical trial or already on their treatment, but no, we are not going to be doing this to our youths. You know, I mean, we're going to provide support. We're going to provide counseling. We're going to provide support for them. But then once they're an adult, they can make the decision to start doing hormone changes and surgery, etc. Well, the U.S. and the American Academy of Pediatrics and other medical entities in America were like, no. A child will be suicidal. You got to give them the hormones. You got to stop the puberty. You got to tell them that we can make them a girl or make them a boy. And don't tell the parents. What? If a child's suicidal, you think a whole bunch of hormones is going to help that? I mean, we need to be there 24/7 with support, 365 days a year. Parents need to be aware. And we need to ensure that the child understands that a decision they make as a child may affect them later in life and might not cure their issue. Let's say I really wanted to be a man. And I'm like, I want to be a dude. It's not going to happen. I'm not going to be a dude. And so, we're almost lying to these kids. Well, the U.S. Department of Health and Human Services yesterday released a comprehensive review of best practices for children and teens. And they are saying, whoa, these gender dysphoria treatments pose significant risks. The report is titled Treatment for Pediatric Gender Dysphoria, Review of Evidence and Best Practices, published by the Office of the Assistant Secretary for Health and Office of Population Affairs. And according to Fox News, and according to a press release from the HHS, they say this review, informed by an evidence-based medicine approach, reveals serious concerns about medical interventions, such as puberty blockers, cross-sex hormones, and surgeries that attempt to transition children and adolescents away from their sex. These types of gender-affirming treatments are recommended by the World Professional Association for Transgender Health. Now, the report highlights evidence including irreversible infertility, sexual dysfunction, reduced bone density, adverse cognitive impacts, cardiovascular disease, metabolic disorders, psychiatric disorders, surgical complications, and regret. The study is citing very weak evidence of benefit. The authors also called into question the ethics surrounding medical interventions for children and teens with gender dysphoria. They say HHS believes that medical ethics should be central in this debate. Absolutely. So a team of medical doctors, medical ethicists, a methodologist contributed to this review. A lot of viewpoints, but they agree. And the NIH director, Dr. Jay Bhattacharya, said our duty is to protect our nation's children, not expose them to unproven and irreversible medical interventions. We must follow the gold standard of science, not activist agendas. And I have individuals in my extended family who are transgender, and if how I look at it is, imagine years ago somebody says, really, you're LGBTQAI plus. Let's talk you into infertility. Let's talk. Oh, we could change you. You don't have to be that way. We could change you. Didn't we, prior to COVID, talk about how disgusting it was that there were doctors trying to claim that they could change somebody from gay to straight? Yet all of a sudden, oh, you know what? That's okay. We could change you from being gender fluid to gender committed. I thought we were, showing people you were born this way. Be proud of who you are. Love who you are. Society is going to embrace you once they shed bigotry and discrimination, and you will be free to be LGBTQAI+. And, we aren't going to try to sterilize you, make you infertile. But what are we doing now? We're identifying children, the people who are advocates for transgenderism. They are finding children, identifying them, pulling them out, and then subjecting them to something to make them change or possibly affect their fertility. I thought that was eugenics. I thought that was something we frown upon. We don't want somebody to go through painful, uncomfortable, higher health risks. So now if you're affecting their bone density and bone growth, they're going to be at higher risk of a hip fracture or any sort of fracture, which could lead to their morbidity and mortality. So what you're doing is you're like, that's okay, we'll shorten their lifespan, but at least they'll be happy. You're not going to shorten anybody's lifespan. These hormones can cause blood clots. These kids are sitting for hours at school. They're sitting for hours in front of a computer. These hormones can be risky. And so the activists who are trying to, they're claiming they are protecting a community, is actually sterilizing the community, putting them in harm's way. And so I mean, if England got on board, I don't understand why it's taking America to get on board. We need to protect our children. And if you really want to help the LGBTQAI+ movement, don't try to sterilize them or force them to be somebody that they physically can't be. 1-877-DOC-DALIAH. Hi guys, Dr. Daliah here. Addictions can sneak up on us and come in many forms, whether it's drugs, alcohol, sex, video games, porn, or something less obvious such as food, internet, or shopping. Addiction can seem innocent at first and then evolve into an insurmountable evil. In our book, Addiction Basics, Caitlin Kalikas and I dive into the common addictions and provide tips for identifying and preventing these before they sneak in and take over our lives. Addiction Basics can be found on Amazon or my website, drdaliah.com. Check it out.
Carl Amari here to tell you about our newest website for old-time radio lovers. It's 100radioshows.com. At this site, there are 5 old-time radio shows waiting for you to download free as our gift to you, and be sure to browse the additional 700 old-time radio shows available to you for 70% off by using the promo code RADIO at checkout. This is a limited-time offer, so log on to 100radioshows.com. That's 100radioshows.com.
At Hot Shot Secret, we share the science behind common diesel problems. For example,
diesel fuel cetane levels.
The cetane rating in diesel fuel is 42 to 45. Most diesel engines operate more efficiently with a cetane rating of 48 to 50. One treatment of Hot Shot Secret Diesel Extreme will raise your cetane 7 points, increase fuel economy, and improve cold starts.
Hot Shot Secret Diesel Extreme is available nationwide at truck stops, fine farm and auto stores, and online at hotshotsecret.com. Hot Shot Secret, powered by science.
In a study, it was found that 33% of 44 herbal supplements had no trace of the advertised herb. Don't let that happen to you. Hi, this is Dr. Mitch. If you want to ensure quality, please go to totalwellness.com. Supplements made for physicians, only now available to you too. totalwellness.com, helping you to look good, feel good, and enjoy total wellness.
We are back on the Dr. Daliah Show. Thank you all for tuning in. 1-877-Dr. 1-877-DOCDALI. Big thanks to Talk Media Network for making the show happen. Big thanks to Daniel, our producer, and big thanks to y'all for tuning in. We really do appreciate it. Don't forget to follow us on X or Twitter at Dr. Daliah, Facebook, The Dr. Daliah Show, and on YouTube, click like and subscribe. So I was just speaking to a group of women, and May is Women's Health Month. We also have Women's Health Week. And I was talking to women about how one thing a lot of us struggle with is doctors and healthcare professionals and society seems to sometimes forget that we have other body parts besides a uterus, vagina, boobies, which means, women's health is not just about a period. It's not just about breast cancer. It's about liver disease, renal disease. So if you want to talk about women's health, you talk about everything, just like you would, with men's health. But sometimes we go the other way. And then we're like, well, it's menopause. She can't sleep. It's menopause. She's, aging. Menopause is very dynamic. And the individuals like our next guest who have studied it thoroughly are giving us such amazing insight into how dynamic and complex a process that is and why if we don't understand it, we could be ignoring multiple health issues. So I'm really, really excited about our next guest, Dr. Larissa Ferdinand. She's an OB-GYN and menopause health specialist that's going to talk to us about a lot of the unique needs that we women face. And men, listen up. Dr. Ferdinand, thank you so much for joining us.
Hi, glad to be here. Nice to meet you.
Awesome. Well, Women's Health Month. People are always like, why do we have to have Women's Health Month? Men's Health Month. I like it because it reminds us that we need to kind of stop and remind, and be aware of things that we might be overlooking. Talk to us about how, what is Women's Health Month?
Yes. I've been an OBGYN for 20 years and known also as the estrogen doctor for good reason. You mentioned the diversity around this area when it comes to women who have unique health needs, such as hormone imbalances. And that can impact things like your nutrition, your exercise, your sleep. So Women's Health Month provides a timely reminder that we need to address these special health issues that require our attention.
Being a physician and doing a lot of gynecology, I was even shocked at how, I was having my period. I had some early hot flashes, but my insomnia immediately triggered my doctor to saying, you're in menopause. And I'm like, really? It's not the mother-in-law. It's not. And you have insomnia. Now you're at higher risk for diabetes. You're at higher risk of memory loss. You're at higher risk of. Talk to us about some of the unique problems that affect women.
Yes, you mentioned sleep. So sleep can impact women in menopause. Approximately 60% of the time, people can report that. But there are other menopausal symptoms as well, like hot flushes, night sweats, and even body odor. And having a common root are hormonal changes that you can experience in menopause. So for sweat and body odor, I recommend Secret Whole Body Dry Feel Deodorant and clinical antiperspirant for women across all life stages. Secret Whole Body is an aluminum-free deodorant designed for use from pits to privates. Secret Clinical Antiperspirant delivers the brand's highest level of protection against 3 types of sweat control. That is your your stress, your heat, and activity. And it's available in both stick and spray forms.
And I love that. I use Secret also. So Secret is my go-to. And people have been asking me that, over the last 2-3 years, you hear from pits to private deodorants and products, and they ask me, is it safe? Is it safe? And many of these are gynecological recommended. Being aluminum free is huge. So talk to us about the safety of these products. Yes.
So when it comes to the safety across the board, and there are a lot of aluminum-free products out there, these are tested and have a degree of assisting women where it's important, because most of the time if we're having body odor or sweat, we lose our confidence as we go through these changes of life. So it's just an added tool in our toolkit where we can be able to enter the world with confidence despite some of these hormonal changes.
One of the largest organs in our body is our skin. and I neglect mine. I hike a lot. I think I put enough sunscreen on. You have a lot of advice for women on that. What do you recommend for protecting skin?
Protecting skin is so essential, and to elevate your body care routine, I also recommend new Olay Super Serum Body Wash Collection. It brings Olay's award-winning skincare technology to the shower. The Super Serum Body Wash is infused with 5+ advanced skincare ingredients and delivers 5 visible skincare benefits all in one. It hydrates, firms, smooths, brightens, and evens. What woman doesn't want that? It has the additional penetration of the skin's surface layers to visibly transform and improve skin in just 14 days. It's available in 3 options for different skin types, and you can find it at your major retailers for around $13.
We're speaking to Dr. Ferdinand, a woman's health hormone expert known as Dr. Estrogen, integrative health advocate, board-certified OB-GYN mentor, and author. It really is an honor to have you on and talking to us. Menopause, very complex. Menopause can start the next chapter that could be one of the most amazing chapters, or it could put us at risk for loss of bone and heart disease. Talk to us about what suggestions you have for dealing with that.
Yes, you bring up a good point. A third of a woman's life is going to be in menopause, and about 6,000 women in the U.S. are going to enter menopause each day. But it's a hot topic right now. Dealing with menopause can be complex, and there are many things out there. So I want to bring about a recommendation I have called Cycles Menopause by Boron. It's a hormone-free, soy-free homeopathic medicine that relieves several symptoms of menopause and perimenopause. So this would include your hot flashes, your night sweats, mood changes, occasional sleeplessness, what we talked about before, and facial flushing. It comes in a discreet melt-away tablets where there's no water needed, and so you can move through this menopausal uncertainty of time with confidence and comfort. You can check out the full line of Cycles products that also includes options for PMS and cramps at boronusa.com.
Gosh, that's fantastic. Nutrition. We can't forget about that. For me, it's let me get everybody else fed, let them, and how important it is for us for the skin, for the bones. Talk to us about nutrition.
It is so essentially important, and honestly, we have the same concern, trying to feed our families and nourish us the same. And then some of us may not even like to eat our veggies. So let me help you fall in love with Amazing Grass Sweet Greens. It delivers a sweet twist on nutritious greens with fruits and veggies and new refreshing flavors. They have summerberry, peach hibiscus, and tropical lime with no added sugar. Amazing Grass is non-GMO, U.S. farm-grown greens that support your vitality, your digestion, and your immunity with real food-based nutrients. It's available at The Vitamin Shop or vitaminshop.com, the leading destination for lifelong wellness solutions.
That's wonderful. If you don't mind, in the final minute, every time I speak to women's groups, the topic of hyposexual arousal disorder, sex drive dropping after menopause, even before menopause. Any advice you have on that?
Yes. Don't make it a taboo topic. This is something that needs to be addressed because it's part of our quality of life, sexual function. So if you notice that there's a wane in your libido or sexual drive, vaginal dryness, or even pain during intercourse, these are areas that you want to bring up and make sure that you're advocating. There's no one-size-fits-all solution. Find a provider or clinician that's going to fit this stage or this season of life. And the most importantly, now that you're aware, act upon it. A lot of times we bear with stuff and someone's told you get over it or it's normal. We want to optimize our care, and what better way to do so in this month and making sure that it's not, like you said before, it's not just one thing. There are many areas that involve elevating our health and bringing attention to it.
Amen. Dr. Larissa Ferdinand, how can my listeners find out more information?
Yes, for all the products that we mentioned today, you can go to tipsontv.com.
Wow. Well, gosh, we cannot wait to have you back. We know you're busy. Being able to share this time, we really appreciate it. Thank you again so much.
Thanks for having me. Anytime.
1-877-DOC-DALI, 1-877-DOC-DALI. A lot to digest there, but, the take home is, don't neglect yourself. Men and women, whether it's Men's Health Month, Women's Health Month, you got to, take care of the skin, take care of your nutrition. Don't be afraid to talk about taboo subjects such as sex, and, live the best life you can. 1-877-DOC-DALI.
At Hot Shot Secret, we share the science behind common diesel problems and their solutions. For example,
Diesel fuel cetane levels.
in many states, the cetane rating in diesel fuel is 42 to 45. Most diesel engines operate more efficiently with a cetane rating of 48 to 50. One treatment of Hot Shot Secret Diesel Extreme will raise your cetane 7 points, increase fuel economy, and improve cold starts. Due to a cleaner burn, there are less hydrocarbons and particulate matter in your exhaust. This reduces the blockage of your diesel particulate filter. Using Diesel Extreme generates 83% less DPF regeneration. The 6-in-1 Diesel Extreme formula also includes the most concentrated detergent on the market, lubricity enhancer, water demulsifier, rust and corrosion inhibitors, and a fuel stabilizer.
Hot Shot Secret Diesel Extreme is available nationwide at truck stops, fine farm and auto stores, and online at hotshotsecret.com. Hot Shot Secret, powered by science.
All right, we are back on the Dr. Daliah Show. Thank you all for tuning in. 1-877-DOC-DALI, 1-877-DOC-DALI. Okay, so one thing I really fear as a doctor and then as myself as a patient is I don't want to get chronic back pain. Seeing what my patients went through with their chronic back pain scared the living daylights out of me. I don't want to have any chronic pain. And sadly, the older we get, the more we run the risk of having back issues. The more car accidents we're in, the more ski accidents we're in, the more things that get done to us. I forget how many total car accidents I've been in. I forget. But that did a number on my back and my neck. And when I say neck, I'm also including neck. I'm talking about the spine, the cervical, thoracic, and lumbar. And then even coccyx. Sometimes my coccyx hurts. It's our old rudimentary tail. And so when I see individuals struggle with low back pain, they could be on a variety of different treatments, anywhere from anti-inflammatories and pain medications to injections to surgery to chiropractic manipulation or osteopathic manipulation to massage to ice. And there are a lot of things we use for low back pain. But a recent study said only 1 in 10 of them actually work. Now, we got to take the study with a grain of salt, because if you have low back pain and you love your osteopathic doctor or chiropractor, or you love your massages, or you love your injections, okay, then it's helping you. But this study on a whole really kind of looked at things, and let me kind of review that with you. So this was a study that was published in BMJ, Evidence-Based Medicine. And they found 1 in every 10 treatments, so maybe 10% of them, may be effective in relieving low back pain. Chronic back pain is one of the most common types of pain, affecting 16 million Americans. I think that number is grossly underrated. I think it's even more. But according to Dr. Aidan Cashin, Deputy Director for the Center for Pain Impact at Neuroscience Research Australia and Conjoint Senior Lecturer in the School of Health Sciences in Sydney, he says our review did not find reliable evidence of large effects for any of the included treatments. Now, they looked at 300 randomized controlled trials looked at data on 56 non-surgical treatments, 56 different ones for acute low back pain, chronic low back pain, a combo of that. And they looked at pharmacological, like NSAIDs, like Motrin, naproxen, muscle relaxants, non-pharmacological exercise and massage. And they said ineffective treatments for acute low back pain, meaning back pain that's happening acutely, over the period of hours, days, weeks, were found. The ineffective ones included exercise, steroid injections, and Tylenol. They said chronic low back pain, antibiotics, and anesthetics were also unlikely to be suitable treatment options. Now, antibiotics. This is being reported by Fox News. If antibiotics were tested, you should not really be using antibiotics for pain. However, a lot of people are doing that because they notice their UTI pain goes away, their throat pain goes away within an hour of taking an antibiotic. So we think there might be some anti-inflammatory effect, or maybe there's a change when the antibiotic comes in and there's starting to be this pharmacological change. The inflammatory cells might be like, all right, guys, let's back off, because a lot of our pain is from our inflammatory cells and the inflammation that ensues. And so there's a chance that maybe that's why people feel better from bronchitis or sore throat or UTIs when they take an antibiotic from a pain perspective, because there might be some sort of a negative feedback mechanism on the inflammatory components. But I don't know what's been studied in that. I just know people say antibiotics help them with their pain, but they say don't be doing that. For acute low back pain, they said non-steroidal anti-inflammatory drugs like your Motrin, your ibuprofen, naproxen could be effective. For chronic low back pain, they said therapies including exercising, taping, spinal manipulation through osteopaths or chiropractors, antidepressants, transient receptor potential vanilloids, these TRPV1 agonists is a new science, or a new avenue of medications that could be used for pain, very targeted and very, very cool. But they said, even though they can be effective, the effects were small. So the findings were inconclusive for many other treatments due to the limited number of randomized participations and poor study quality. They say we need further high-quality placebo-control trials to understand the efficacy of these treatments. So that's why I said, guys, take this with a grain of salt, okay? I mean, just because this study says, well, chiropractic or osteopathic manipulation may not work for long-term low back pain. Listen, they even said that the study had limitations. So if you like it, do it. If you don't like it, if it doesn't work, you don't do it. If the injections help, great. If they don't, they don't. But what I think is really going on is people's back pain. It really depends. Is it a disc issue? Is it arthritic issue? Is it a dependence on pain medications? Is it a threshold issue? Is it a low serotonin issue? I know some of you are like, antidepressants. Why are they studying that? Well, because we found people with lower serotonin may be more prone to hurt. Yet when your serotonin is higher, it may not. But like, did you guys ever bang your elbow and hit your funny bone? And on days when you're in a bad mood, you're like, son of a... But on days when you're in a good mood or you're excited about something or you're at a concert, this is what really blows my mind. Concert injuries. I'm not talking about the severe ones. How many times have we been banged around and somebody hitting your head or tripping you and you falling and bleeding or whatever, but you're at a concert, you're having a good time, you don't feel it. You might feel it the next day. So when your endorphins are up, your serotonin's up, your dopamine is up, yeah, that could have an effect on pain. So that's why those things were studied. But some people have such severe spinal stenosis or narrowing of their spinal cord, such severe pathology causing their pain, that yes, a lot of these things might not work. Now, a lot of when somebody does have severe back pain, the medical providers, and I see thousands upon thousands of pages of notes every month because I do disability exams for the state and workers' comp exams. And you'll see doctors will say, look, we could do a trial before we jump into surgery. We could do a trial of anti-inflammatories. We could do a trial of physical therapy, trial of massage, hot, cold packs, injections. But if it fails, we might have to go and do surgery. But no doctor's going to jump right to surgery for back pain, without at least trying conservative measures. They're called conservative measures. So for some people, it does work. They say, you know what? I don't need surgery. It's livable. I'm fine. I could deal with this. It's not getting worse. For others, they go, I can't take it anymore. I need the surgery. Now, another thing, too, that I always tell people is if you had a life where you were 0 out of 10 pain and you never felt pain, and all of a sudden you've been in a car accident or you've had a broken bone or you have an issue, your pain threshold's different. Success, yes, albeit amazing success, would be going back to 0 out of 10, but you might be at a 1 or 2, and that might be the best you're going to get. And you have some individuals that will sadly hurt themselves by taking pain pills and do other things because they're like, but I'm not pain free. So because I'm still having some pain, I need to take something. I need to do more. And they don't realize that the 1 or 2 out of 10 might be your new norm. I have hip pain and knee pain. I was very lucky after my ski accident or after my car accidents to go down to 0 pain. But on some days, if I think about it, I'm like, okay, wow, yeah, it's a 2. That's a 3. And doesn't mean I have to take a medication for it if it's livable, But if you're having chronic inflammation, sometimes we do like to minimize that inflammation, but you got to be careful with these NSAIDs like Motrin and naproxen because it can affect your kidneys, your heart, your stomach, and your liver. 1-877 Daliah, don't go away. Dr. Daliah here. Are you tired, burned out, gaining weight, succumbing to the daily pressures of life? Well, how's your dopamine doing? How you feel right now, how you'll feel an hour from now, and how you'll feel next week is completely reliant on your dopamine. Our daily motivation and willingness to push through challenges depends on the intricate chemical process dopamine provides. Christian Kalikas and I created Deploying Dopamine, a book that tells you what dopamine is, when it dysfunctions, and how to successfully deploy it when needed. Find Deploying Dopamine on Amazon today. Check it out.
In a study, it was found that 33% of 44 herbal supplements had no trace of the advertised herb. Now, don't let that happen to you. Hi, this is Dr. Mitch. If you want to ensure quality, please go to totalwellness.com. Supplements made for physicians only now available to you too. totalwellness.com, helping you to look good, feel good, and enjoy total wellness.
Self-reliance. It's not a phrase we hear much in our culture these days. It might conjure up images of pioneers, the West, rifles, strapping men, and strong women. But what does it mean for us in today's world? The New American Magazine has just released its latest collector's edition, Self-Reliance, Foundation of Freedom. In it, the New American authors outline the necessity of self-reliance for a free people, tips for self-reliant living, and the importance of not giving up hope. This unique edition includes articles on the self-sufficiency of the founders, preparing for a worst-case scenario, firearms, financial self-reliance, the importance of community, and many other topics by expert writers. Now, for a limited time, the New American is offering a bundle of 3 collector's editions, Self-Reliance, The Great Reset, and Trump World, for just $19.95. Available at shopjbs.org. Visit shopjbs.org today.
We are back on the Dr. Daliah Show. Thank you all for tuning in. 1-877 Doc Daliah, 1-877 DOCDALI. So I was on the phone with the patient this week, and as I was finishing, writing his medication, and I always ask him, is there anything else I could help you with? And he said, well, I've had 2 failed marriages. Do you know anybody single? Like, sorry, that's not what the service provides. But good luck with that. Okay? Well, yes, I do have some single friends, but I'm probably not going to match make anybody when I'm just supposed to be performing medicine. But that term failed marriage bugs me. I hear that a lot. where a divorce is the only thing that gets the credit or the notoriety for being a failed marriage. What about some of these marriages where there's domestic abuse, where there's animosity, and they're married, but they don't, talk to each other, they don't live with each other, separate rooms, etc. What about a family unit where the kids hate their parents? Is that maybe a failed marriage? We're going to be talking about later. Apparently, Ben Affleck is now talking about his relationship with Jennifer Lopez and getting married. I think he said he's embarrassed, and they might, and so people go, oh yeah, so this is Jennifer Lopez's third maybe failed marriage or fourth. I don't know. I don't keep count. But I sometimes a divorce is strategic. Now, I mean, if you say your vows, I'm with you till death do us part, and sickness and health till death do us part. Yes, that is then a breaking of vows if you end up getting divorced, because you vowed to be together for the rest of your lives, and sickness and in health till death do you part. For better, for worse, in sickness and health till death do you part. I don't remember my vows because I was just so nervous about sucking it in, right? And the pictures, and I was standing on the wrong side. I stood on the wrong side. In a Jewish wedding, you're supposed to circle the groom, I think 7 times. Again, I don't remember. I was still half asleep because I was in my 4th year of medical school doing call, and I only had a 2-week break to get married, go on my honeymoon, and come back. And so after I landed, after the 7 circlings, I guess I stood on the men's side, right? Even though my bridesmaid, my maid of honor was going to be my best friend who was a guy. We ended up not doing that because my mother-in-law didn't like the idea of him wearing a dress and all that. But anyway, so we never went through with it. But I'm standing on the men's side. So I'm looking at my brother, and I'm looking at it. It's like, okay, so I don't really remember the vows, but my guess is the vows had to be for better, for worse, and sickness and health, to death do you part. And so if you do divorce and decide to separate and end, or you broke those vows, you bailed when they were sick, or you were not faithful, okay, yes, I could see why failure might come up as a term. But when somebody is divorced, or they say, I'm divorced, I don't look at it as a failure. I look at it as a strategy. What if the argument is you're with somebody who's bad for you, who's toxic, who hurts you, can hurt the kids? Isn't it successful for you to get the hell away from that person and get the kids away from that person? I understand in society, and Dr. Laura Schlesinger, very anti-divorce. You shouldn't divorce. You made the decision. You stick with it. And I understand that was her thinking when I used to listen to her show 15 years ago. I don't know if she still feels that way. But I look at it as, I think it's a failed marriage if you continue to allow the toxicity and the animosity to thrive. And a successful divorce is one where everybody's amicable. You don't get the lawyers involved to the degree where everybody's doing the money grab. And it blows my mind how usually when people do break up, they want it to be amicable. They're like, let's make it simple. I don't want this to go on. I don't want there to be animosity. And then all of a sudden the lawyers are like, well, yeah, but they're screwing you over. Don't you see that? So you need to now go on the offense, and you need to get, and then all of a sudden, the only person who wins are the lawyers. Now, mind you, there are some people that do get screwed, and that's why you have a lawyer, to protect your interests. But by the time that's all said and done, everybody failed. So a successful divorce is one in which you could still be there for the kids. You could still, in essence, be a family unit. Maybe not necessarily living together, in, having eventually new husbands or wives, as a part of this family, and where the kids are getting their needs met first and utmost as the top priority. And a divorce doesn't necessarily have to be a failure. I remember that Friends episode where Ross marries Rachel on a Vegas whim, And he didn't want to divorce her because then that would mean he's had, is it 3 or 4 failed marriages? I forget how many. And so that term has been used since the 90s, 2000, for years. And maybe we need to look at that differently. Now, and maybe some people got married for different reasons. Maybe their marriage was a complete success. They loved each other. They had kids. They supported each other during the time of their life, but they grew apart. When you use the term, we had a failed marriage, the kids feel like they were part of that failure because the kids were a product of that. So you got to watch your terminology. That's why I think we need to get rid of that terminology completely. Imagine being kids where you love your mom, you love your dad, and you keep hearing failed marriage. And you think because you were the product of that marriage, you contributed to that. Say we grew apart. Say we decided to end our partnership. How many partnerships have ended and it still worked out in their favor? Kurt Russell and Goldie Hawn, right? I believe they're not married. Does that mean it's failed? No, they have a very successful relationship. They chose not to marry. I believe that's still the case. But so if they break up, would that still be considered a failed? Oh, well, it's not a failed marriage because they weren't married. I think we're using these terms wrong. And I'm surprised they're still being used. So, my patient out there, I hope he finds love. I hope he finds a partnership. For those individuals who have multiple divorces or multiple issues in terms of finding a partner, why is that? Is it that you're forcing yourself to live with somebody you really don't want to live with? Is it that some people can't really live with other people? Now, is it that you haven't found your one true love? And with your one true love, they could burp, throw up, have diarrhea. Anything they do is magical. But for most of us, no. We put up with a lot. Okay, a fart will still stink, all right? Whether it's your true love or not. And so maybe you also need a sense of be more realistic. And this idea of marriage, I'm a proponent of. I love the idea of getting married. I got married. I hope my boys get married. I'm a big fan of that. But I think there's so much pressure that, you can't fight. You can't, not want to be in the same room with them sometimes. You not want to. It blows my mind how naive people are about relationships. It's very normal to want your own space. It's very normal to sometimes just want to go out with the guys. Just go out with your friends. It's very normal to sometimes want to sleep on a couch or in another room if the other person snores and keeps you up. If you get a better night's sleep, you know how many couples are freaked out because they get a better night's sleep sleeping alone? You can still be intimate and have sex, but then you might sleep better. However you sleep better, you sleep better. It doesn't necessarily mean it's a failed marriage. 1-877-DOC-BELLY.
Did you know that healthy arteries make a gas? Yes, actually 3 known gases. Hi, I'm Dr. Mitch, and nitric oxide is a gas that's readily made all day long to keep our arteries open by relaxing the blood vessel walls. By doing this, our circulation is increased, bringing blood, oxygen, and nutrients to every part of your body. Both age and poor diet can lead to a loss of this precious gas, and in turn, blood pressure can go up, energy can go down, and you can get tingling in your hands and feet. Well, our product, Ultimate Nitric Oxide, can easily help fix this lack of nitric oxide. Go to TotalWellness.com. That's TotalWellness.com, where we are helping you to look good, feel good, and enjoy total wellness.